We think we have to go into work when we're really sick, and that's not good either.
So let's say I'm your fairy godmother and I can give you three wishes. What do you think the three things that you would change that would affect the most in terms of preventing burnout or mitigating burnout or
Can I blow it
alleviating?
up and start over or no?
uh, that would be too much of an ask. Let's say three things that you can change within the system now.
Because sometimes I feel like, what the best thing would be to start over. Like how it was built was wrong.
Mm.
We're dealing with what was built. So what I would like to see is that people can get back to practicing medicine and, doing it the way that they would like to be doing it, which means like this somehow figuring out a balance between all of these needs and letting the focus go back to letting people do the work that they want to do.
Yes,
So
yes.
whether that's removing some of the burden with someone else doing some of that work, valuing our time differently so that we're not just like machines that are churning out patients every 10 to 15 minutes, that like how long we spend matters, that patients feel listened to and understood and heard matters, and like value is defined a little bit differently than just like churning out people, which is not how it is currently defined. I think that I wish that we didn't have to have the hours and this stuff that we would like need to do. And so I think outside of sort of finding a way to let us just practice, I would also say we need more redundancy, meaning like more people that can cover when we're out, that can support us in some of the work day to day. Like I feel very regularly like we are having to like step up and step in as the only, and that doesn't help because we think we have to go into work when we're really sick, and that's not good either, physically sick and mentally sick. And so like redundancy would be great, focusing on what we got signed up for in the first place would be great. And then like there are people in medicine who need to be compensated better for the hours that they put in, and residents would be high up on my list there. The amount of work that people do in training when they're not compensated appropriately, hourly, that is like obscene a little bit. Like I get, it's hard to talk about money in healthcare, but if you like took their hourly wage, you would understand why I'm mentioning residents
Yes,
in
it's below minimum
particular.
wage. Yes,
Like
yes.
I always think it's weird. It's hard for somebody who's like an attending to be like, I should be paid more, because in the grand scheme of work, we're paid a lot more than a lot of jobs. And so there's a lot of privilege in that. But I do think that like when you look at residents, if you did their hourly math and where they're living and the cost of living in those places and the expectations on them and how much a hospital depends on them, like we just don't do a good job by them.